You want two devices?
Yes.
ವಿಡಿಯೋ ಕಾಣಿಸ್ತಾ ಇಲ್ಲ.
Like right. So all the best.
Thank you. Good morning. Wishing you all a very, very happy, harmonious morning. My name is Anita, and I welcome you all for this beautiful transformations session. And a very, very warm welcome to all my Harmony Sunrise family. I'm so thrilled to be here with all of you today, whether you're one of our regular who shows up bright and early every day or a new face joining us for the very first time. A big warm welcome to each of you. You have just made an amazing choice for yourself today, and I want to take a moment to acknowledge that. And if you're new, let me tell you, you have stepped into a space where health and wellness and positive energy are our top priorities. This is more than just a morning routine, it's a life transforming habit. And for our regulars, you already know the magic of Harmony Sunrise. You're a living proof that showing up for yourself consistently create a lasting change. I want to encourage all of you to stay plugged to our YouTube channel. Every session is designed with you in mind to uplift, energize, and set for a healthier, happier day ahead. If you haven't already, make sure to hit subscribe, like, and share button and turn on those notifications so that you never miss a morning with us. Here's what we have lined up for today's session. We will begin with a calming intention meditation to center ourselves, followed by an affirmation and a wisdom quote to set a positive tone for the day. And after that, we will move into some energizing exercises to get our body moving. And then dive into an applied knowledge talk to expand our understanding of health and wellness. Now, this applied knowledge, though it may be a little small, please, but do plug in where we are doing weekly series about each topic. As this week we are doing on bone health and joint health. I have learned personally so much the causes, the benefits, what we do, the exercise, the role of the rest. Oh my God, so much to learn. And it is presented in such a simple way that anybody, even a layman, can connect so well. So do take best advantage of this session. And finally, we will wrap it all with a delicious and healthy recipe which you can easily try at home. Together, we are creating a community where we thrive, grow, and glow. So let's keep that momentum going, shall we? And I would encourage everyone here to be active, whoever are in the WhatsApp group, be active in the group and take the full benefit because this session is for each and every one. You see, any challenges you have, any simple pattern you want to change or habit you want to, change, knowledge everywhere. We are flooded with so much of knowledge. What is the beauty of Harmony Sunrise community? That you get a handheld support to bring out changes within you, any pattern. Try it. Do join us every day and just not watching it. Be a participant. And then you see the small changes you will observe within yourself and surrounding you. It can be your emotional up and down or health wise. You see, when you start your day, how you're doing, and if you bring the changes, what we are saying, and incorporating and integrating with your life, you see the beautiful changes you will experience. With that, thank you for being here, and let's get started on today's session with a very beautiful intention meditation. Thank you. Let's go.
Good morning. Thank you, Anita. Welcome to all of you for this wonderful day. And we are starting with the wonderful intention setting right now. And you all by now know the intention setting will make your day and it will set your energy in the right direction. Let's sit down for that. Please sit down with the back and the neck straight. And now gently close your eyes. Focus on your breathing. Let the breathing becomes deeper and deeper. Inhale slowly and deeply. Exhale slowly and deeply. With the deep breathing, you are getting into deep state of relaxation, and it is a very powerful state of mind to set the intention, reprogram your mind for all good things you want to bring the change in you. Breathe in on slowly and deeply, and breathe out slowly and deeply. You are in a very deep state of relaxation now. Now, let's set the intention for a wonderful day, a wonderful experience today. And all the experience what we have in our life, it happens through our body. This is the most important asset in your life. And everything what we need to do is to take care of it first. So let's reprogram ourselves and set intention. My body is my priority and I take care of it well. And body, the frame is what is important. The frame of the body is the bone and the joints. Since this week we are focusing on the bone and joint health, let's focus on reprogramming our mind and setting intention that I take care of bone and joint health by eating the right nutritious food which takes care of the vitamin D input both in terms of food as well as getting exposed to the sunlight, and also calcium intake, adequate calcium intake, and wherever is necessary, I also supplement with the good natural organic supplements to take care of the bone and joint health. As I know, after 30 years, the bone goes through demineralization every day. That is compensated by nutritious food and also good quality natural organic supplements. Now, I also do all the required exercises which enhances the bone and joint health, and many of them are taught in these Harmonies and Rise sessions. Hence, it is my priority to be in the live session every day. That shows I have given the priority for my own health of the body. I also take care of rest in the right way. I go to sleep early. I have a wonderful, restful, regenerative, recuperative sleep. And I also take care of my mental health by giving the positive input every day and almost all throughout the day. Take care of the hydration of the body right way. And also, I keep my relationships in a very harmonious way. So, which makes me, my happiness index keeps increasing every day because of all these things. I do it in a right way. Let's set the intention for a wonderful, productive day, managing all the activities in a right way. Let's thank this body and mind for giving a wonderful life experience. Let's thank the divine entities for the wonderful blessings I have. Bring your focus back to your breathing. I'm going to count up from 1 to 5. Every count you become more awake. At the count of 5, you open your eyes, become completely wide awake, feeling excellent, blissful, and happy. Let me start here. 1, 2, 3, 4, 5. Open your eyes, become wide awake, feeling wonderful, happy, and energetic. Wonderful. Excellent. Thank you very much. Have a wonderful and blessed day. Namaste.
Namaskaram, and thank you, Balu, for the wonderful intention setting session. All of you agree that you have a mind and you have a body. Now, how to ensure that your mind is in your control is by filling with the right thoughts and the right wisdom. So today, let's look at today's wisdom quote. Pain, stiffness, swelling, and reduced movement suggest joint issues. Let me repeat. Pain, stiffness, swelling, and reduced movement suggest joint issues. Let's look at the affirmations. These are the positive thoughts to keep you stay positive and energetic throughout the day. These everyday affirmations were practiced by Dr. APJ Abdul Kalam. I'm going to read it along with me for 3 times. We will read all together, one after the other for 3 times. Let's begin. I am the best. I can do it. God is always with me. I am a winner. Today is my day. I am the best. I can do it. God is always with me. I am a winner. Today is my day. Once again, I am the best. I can do it. God is always with me. I am a winner. Today is my day. It's good to say these affirmations loud and clear. And while doing that, please keep your right palm on your heart. So there's a lot of body benefits that comes for it. Let's look for today's specific affirmations to go along with the theme of the day. Right? Each one I will repeat thrice, one at a time. So please join along with me and say it out loud for yourself, keeping your hand on your heart. I am in tune with my body, recognizing early signs to protect my joints. I am in tune with my body, recognizing early signs to protect my joints. I am in tune with my body, recognizing early signs to protect my joints. Second affirmation. I nourish my bones with the right nutrients, helping them stay strong. I nourish my bones with the right nutrients, helping them stay strong. I nourish my bones with the right nutrients, helping them stay strong. remember these affirmations throughout the day. Repeat them as many times as you want. Let it become the dominant thoughts in your mind so that you are always moving forward in the right direction and enjoy the life. Thank you very much.
Thank you, Anand sir. Good morning, everyone. I am Nanjapa, today's fitness instructor of the, today's theme is based on, signs and symptoms of bone and joint health. So we need to understand, today I'm taking you through a yoga flow of strong legs. Okay, 1 second. I'll adjust my camera. I think this is good now. Okay, so for having a strong legs, you need strong bones and strong joint. That's your knee joint, ankle joint, all this. So we'll do a yoga flow for strong legs. Stand straight, lift up your toes, and then place it firmly on the ground. Keep 1 foot distance, between your foot. We'll do Utkatasana. Utkatasana is also called chair pose. Okay, chair pose. We'll lift up our hands. With a exhale, we'll go down in a squat. Like this. You need to understand and make sure that your knees doesn't cross your toes. Let me show you from the side. Your knees should not cross your toes. Your back should be straight, your butt, behind. We'll do this 5 times. Okay, this is very good for your, all parts of your legs. Let's go. 1. Pause when you're down for a couple of seconds. Let's do the second round. 2. 3. 4. 5. Fantastic. Now we'll do Veerabhadrasana. Veerabhadrasana. We'll do Veerabhadrasana 1. Okay. Now place your right leg forward like this. Try to, try to make your right thigh parallel to the ground. Okay. Do how much ever you can. Your left leg is firmly planted at the back, and the foot is 60-degree, slant. It's not straight like this. It is slant 60-degree. And be active in your left leg, which is at the rear. Okay, now take your both the hands to the top with being parallel. Okay, let's do it now. Place your right leg forward. Bend it at the knee. With an deep inhale. Take your both hands up. Pause for a while. Come to the normal position now. We'll do the same thing with the other side. Now point your toes, that is the left toes, to the front. Front of your body, and let your right leg, the toes, let it be 60 degrees. Now bend your knees so that your thigh is parallel to the ground. Keep the left leg, right leg very active. Take both your hands to the top. Let it be parallel. Give a few seconds pause here. You'll feel the burn in both your legs. Release. Now we'll do the Trikonasana. Trikonasana, you spread your legs, keep around 4 feet distance. Again, turn your right foot towards the side, front. Then your left foot should be around 60 degrees. Then spread both your hands and don't turn, bend forward like this. Then try to bring your palms and touch either your shin or your ankle, or you can place it on the ground. Do how much ever you can. Your left hand should be straight up and your gaze should be to the ceiling. Take few deep breaths here. I hope you are doing it along with me. This is the triangle pose or Trikonasana. Now slowly come up. We'll do it to the other side. Keep your left foot to the front. Let your right foot be at a 60-degree angle. And then move forward. Place your left hand to the shin, ankle, or if you can, touch the ground like this. Your gaze should be towards the ceiling, seeing your right hand. Take a couple of few deep breaths here. You'll feel a nice stretch on your left leg. Now come up. Relax. I think now we'll take the plank pose. Plank pose, you need to come on your palms. The palm should be straight below the shoulders. Your legs should be straight. This is also called Falakasana. This is a very good pose for the entire body. Now here, rock back and forth like this. Keep your breathing slow and deep. Now we'll do Marichasana. Marichasana, you need to sit up straight, keep your legs active, pull up your knees, and then bend one leg. That is, bend the right leg, and your right hand should come inside of the right leg, right knee, and wrap it around your leg. That is the right leg. I'll show it this way. Your right leg is bent here. Your right hand should come inside of the right leg, turn it around, and then wrap it. Your left hand should go, and you should hold the left hand with the right palm. From the back, I'll show. Just try to do this how much ever you can. Take few deep breaths here. I hope you can do this. Release. Now we'll do to the left leg. Fold your left leg. Your left hand should come inside the left leg. Turn it around. Turn your palms outside, and then try to wrap it around your left leg. Your right hand should go at the back, and you need to hold this for a couple of breaths. Release. Now we'll do kneel to heel. Come on your sit with your legs bent like this at this angle. Okay. Then you can place your hands behind you, or even you can come up on your arms. Okay. Then try to bend your legs both sideways. That is, you have a 90-degree angle when you bend. Both the legs should be 90 degrees at your knee. Just like a car wiper. You can even come onto your arms and then do this. You'll feel a deep stretch when you're going right. You'll feel a deep stretch in your left hip. And when you're going left, you'd feel a deep stretch in your right hip. Okay. Now we'll do Upavishta Konasana. Spread both your legs. Bring your hands forward. Keep your back straight. You feel a deep stretch inside of your both of the legs. Now try to grab your foot. and bring your head further down, keeping your back straight. Do how much ever you can. Release. Take few deep breaths here. That's it for today. You need to keep doing a combination of these exercises, and I wish you strong bones. Thank you.
Thank you, Nanjapa. That was a wonderful joint exercise, and it was very good for the lower limbs. Now, let us see some applied knowledge about the signs and symptoms. The signs and symptoms are something very much used in medical field. For every disease, when a patient comes to us, we always ask for some symptoms from your side, and followed by we elicit some signs on the patient body and other necessary experiences from the lungs or abdomen and other things. Then we come to a conclusion saying that, okay, these are the symptoms, these are the signs in alignment. Okay, this could be this particular problem or the disease, what we call it as. Then what could be the common signs and symptoms that we can see with joints and bones and joints? Common is when the patient comes with pain, because that's one single entity which can give us a wide variety of problems, because they have only one thing: pain. That's it. Okay, the pain in maybe secondary to the lump in the bone or some brittleness or some crackling sound in the joints. These are some of the symptoms which they come with, and this could be, I'm not telling you, for any of the reasons. It could be a metabolic disorders in the body, or it could be an infection. It could be a overuse or a repetitive use. These are some of the things which we commonly get. Some people will come with backache, especially elderly people. They come with some backache. That is because they are overusing or they are using in an abnormal positions, which can cause some sprain or muscle catch, all these things. If it is getting relieved in a day, most probably they will not seek the medical help. But when they find it difficult for a long time, then they will feel like coming for the medical help. Okay, that then there could be some lumps or the swelling like things in a leg. That may be an old fracture or a partial fracture which has not healed properly. We call it as osteomyelitis, or there is a hardness of the bone, or when it is post fracture which is healing, the proper healing process has not occurred, or there may be some amount of liquid rice things which is coming out from that particular fracture site. These are some of the signs and symptoms which we can identify. Other than that, when there is a pain, the pain may be secondary to anemia, when the bone marrow doesn't produce sufficient amount of red blood cells for the circulation, which is very essential for your oxygenation of each and every cells and the tissues. That time, there may be a vague pain. They doesn't know where exactly the pain is. They just come and say, "Sir, body ella pain." Where exactly the pain? They themselves doesn't know how to identify that, and they come with that. These are the places where we also try to identify with the laboratory investigations and try to go towards the diagnosis which it could be. Sometimes we will also have patients with coming with vague pains. Then when we see, they may not be having an optimal, I mean, may not be able to identify the fever level or the fatigue level. There may be just a fatigue which can cause that post viral fever, especially. They will have land up with a lot of malaise type of things. Some of them with fever, they will also have some body pain. And when we find such things, we give some analgesics and antipyretics, I mean, for the fever and other things, then they will get reduced. Other types of joints problem is people sitting for long hours. Especially earlier days, it was this vendors type of people who sits in a shop for long hours and they keep doing all that weighing things, other the ingredients without moving from the place and sitting there for a long time with the joint pain. This type of reduced joint mobility would have later caused them unable to stand up, unable to walk properly, has got a lot of irritation or crackling sounds in their joints. These are some of the joints related symptoms. Some of them, weight bearers, coolie type of people who can, lift a little bit of weight. Usually, it's about the body weight of yours is supposed to be like if I'm 70 kgs, I should be able to carry 70 kgs. But people like, workers who work for long hours, they carry a lot of overweight, more than their capacity to hold it. And that lands up with problems, something like muscle catches, muscle at the back catches, knee joint and hip joint, rubbing and what we call it, age related changes in the joint. ಕನ್ನಡದಲ್ಲಿ ಸೌದೋಗಿರೋದು ಅಂತೀವಲ್ಲ ಆ ಥರದ್ದು. हिंदी में घिस गया, joint में घिस गया है. That type of things they come with, and they say that there are a lot of pain in that. And when, especially when they are climbing up or climbing down, when they sit and get up, these are the some pains. That is called overuse injuries. As we age advances, there will be osteoporotic changes. When the changes in the bones, up to earlier when we were starting today's program, our speakers were telling about, you can deposit calcium and minerals to the joints up to the age of 30, 35 maximum. But after that, it's only the withdrawal. There's nothing you can deposit, or you can supplement it for the day-to-day uses. When there is no sufficient deposit kept there, what you can withdraw? That means when you are not sufficiently kept the micronutrients, calcium, minerals into the bones, what we can withdraw? That is where it goes for the osteoporotic changes, and bone will get thinned up, and small trivial fall can be sufficient enough for us to get into a fracture. And some other symptoms, there can be a bone cancer which can cause a vague bone pain in the body, and we will feel that there is a pain, but as such we don't know for what reason. When we go for regular investigations of blood tests and other things, we'll come to know there are so many other diseases which we get. Some of the muscles pains are secondary to your autoimmune diseases, or secondary to muscle injuries per se, in maybe a road traffic accident causing a injury to the body, and that can cause only a muscle pain, ಮೂಗೇಟು ಅಂತ ಕನ್ನಡದಲ್ಲಿ ಕರಿತೀವಿ, muscle pain, but there is no fracture or any such things on the body. Then there could be some neurological issues which can cause pain secondary to some other injuries in the brain and neurological tract, can cause a vague pain. Sometimes, patient after there is a fracture, and when we say that limb is not working properly, we may remove for the life-threatening injuries. At that time, the patient will have a phantom pain, phantom limb. That means there is no limb existing, but he will feel that there is a limb which is causing him the pain. As such, when you see physically, there is no limb. There is a phantom limb or the phantom limb pain. Then we can get into some of these, overstretching of the tendons and fascias and ligaments, which are the what you call it as connecting tissues, which can cause you stretch pains and other things. Some of the times, we may have some amount of dermatositis, that is secondary to the fever, or secondary to other changes which can happen in your body. You will feel a touch pain on the bodies. It is not as such the pain of the muscle or the bone or the joints, just a touch causing the pains. That may be secondary to some neuritis, especially when we see with patients of diabetics. They will feel burning sensation, or touch, when you touch there is some pain in my skin, As such, this is not secondary to muscle or to the joints. It is due to the deficiencies in the vitamins, which is causing this. We call it as diabetic neuritis or neuritis per se. Some vague symptoms are there when patients comes with depression. They doesn't have the proper picture where the pain is. They will come with some pain symptoms. Then overstretching of their body can also cause a blunt, vague type of pain. Sleep disturbances. Some people will come with pain. These pains are not secondary to muscle per se or the uh, bones, but it is all put together, psychosomatic expression of the deficiencies what we have. It may be secondary to some vitamins or minerals or any of these deficiencies. Then how do we take care of these things? There are so many other signs and symptoms which we can talk about, but how do we take care of these things, or how we are going to spoil these things? One of the things which I spoke 2 days back about the nutritional benefits, or the how the nutrition takes care of your bone and muscle health. But how we can spoil is consuming the alcohol, having the cocaines, having the smoking, all these things, and long term antibiotics and other things which we keep taking can cause discrepancies in your vitamins and minerals, which is otherwise very much helpful for your bones and joints. When we talk about what should I do when I want to take care of my bones and joints, 2 days back I spoke about the nutritional benefits or nutrition which can help in your bones and joints. Now I suggest you is all you have to do is take the proper nutrition regularly, and do whatever the deficiencies are there covered up with supplements and adequate physical exercise. I'm repeating it. It is adequate physical exercises, not overdoing it, not underdoing it, and strengthening your muscles with a weight training or stretching exercise as Nanjapa showed you today. And some of the strengthening exercises which I talk, and some of them which Jairam Reddy talks about, these are put together, combined, at least 30 minutes to 1 hour. If you do a regular exercise, that will suffice for your needs. With that, I'll come to the end of this explanation about the applied knowledge. Namaste. Thank you.
Thank you, Dr. Girish, for that wonderful information in a simple language. Let's look at the one of the wonderful recipe which will help in terms of bone health. Makhana. This is the seeds of lotus.
If you add roasted makhana, that's your along with some curd, jaggery powder, some pistachios, and some saffron milk, and blend this to a smooth mixture. Then add this to any container or a bowl, top it up with some nuts, and refrigerate it for a few hours. You would have made yourself a healthy and incredibly delicious pudding, which is made using wholesome ingredients. So easy to make. This is something you've got to try.
Wow, that mouth-watering, such a delicacy. And with this, as we wrap up for today's session, take a moment to appreciate the time you dedicate to your health and well-being. Let the intention we set this morning stay with you throughout the day, reminding of your strength and purpose. And what a beautiful talk by Dr. Girish. Such an insightful, and so simplified way he has put across. I would encourage everyone to please go through the YouTube channel once again to catch up the glimpse of it, and let that sink with you, that knowledge. And stay mindful of your thoughts. Nourish your body with kindness and trust every small step you take brings you closer to your healthiest and happiest version of yourself. And I hope you did the exercise with Mr. Nanjappa, the affirmation with Mr. Anand Reddy, and the intention in the process. Every single step has its own contribution and own significance. And with this, we look forward to seeing you again tomorrow, same time, as we continue this journey together. Until then, be well, stay positive, and remember, your health is your true wealth. Have a wonderful and